hypnosis fascinates and frightens. Information about it abounds, especially on the web. But as in all things, it's buyer beware. Hypnosis is a natural ability we all possess that has value and occurs every day of our lives, whether we know it or not. Hypnosis has one mechanism underlying its various forms. The purpose for using it differentiates the variations. So in stage hypnosis, it's for entertainment. In dental and medical hypnosis, it's physiological or psychological control. And for mental health care, it's psychological adaptation and change. The role of the hypnotist in the dental setting, and they're not needed for self-hypnosis, is to act as a coach assisting you to use your natural ability on demand. There are many uses in dentistry. The following illustrates some of the psychological applications.
How did you decide to get hypnosis for your dentistry?
Well, I think it was a direct result of several dentists deciding that I needed to see somebody in order to be able to commit to regular dental upkeep.
Now, before you saw us, what did you know about hypnosis?
I was familiar with hypnosis. I had used hypnosis relaxation to prepare for childbirth 30 years ago.
The experiences that you encountered here with hypnosis, how do they compare or relate to the hypnosis you used for the child?
It was a reminder, the process with you was a reminder of how to access something that is internal and available to me.
Now, before you started using the hypnosis for your dentistry, how did you get your dentistry done?
Oh my God. I had dentistry done by kicking, screaming, biting, literally, my dentists, having 40 years of referrals to dentists who would give me care under anesthetic or with needles or with a prescription drug before I reached the office. So my care was intermittent. I missed appointments. I had a lot of drama and required family members to take time off work to get me to the appointments because I wouldn't be in any shape to get myself home. So that's how it was before.
If we consider that was your regular approach to dentistry, what was it about that approach that ultimately gave you the impetus to change?
I think it just seemed ridiculous to have to go through so much in order to have good dental care. So I was committed to good dental care.
Okay. Now, in terms of the hypnosis, either 30 years ago for childbirth or for the office, did you find learning the skills difficult?
No, surprisingly easy.
Okay. What characteristics or skills do you think you needed to have to master the use of self-hypnosis, either 30 years ago or again today?
I suspect it's just the skill of being a human being who's willing to learn how to work cooperatively with my own body and my own fears.
Interesting. And you didn't consider having any specific personality traits that might be necessary, or mindset, or anything about the experience?
I'm afraid I'm highly motivated by hitting a wall. So when there were no further options and it wasn't working anymore, I looked for something that I could change, that wasn't external, that was internal, because external wasn't working.
So essentially something in your total control.
Yes.
Okay. Now, do you use the hypnosis in other medical contexts outside of dentistry?
I don't have other medical contexts. However, I use it for getting to sleep at night, because in the process with you, we did a countdown, and I think you said count back from 100 back to about 94. You're not likely to need to go past 94. And darn it if that isn't accurate, because I'll count back from 100, and when I get to 94, I just feel like my tongue has become lazy and I don't get to 93. So I'm quite capable of falling asleep by 94.
Okay. So is there anything else you use it for other than...
Anytime I have an opportunity to be impatient, I just do the counting, so I count back. I do have some circulation challenges in one leg because I have a titanium rod in my left leg and ankle surgery, and my temperature of that leg is often very cold, even in hot temperature, and very, very cold in cold temperatures. And I'm able to use the hypnosis that you taught me to warm up the cold titanium rod.
Okay. So you find that you can control your physiology then? Excellent.
Yes.
Would you recommend it for others?
Absolutely. I recommend it for general context for all stressful or limiting places in someone's life. And dentistry, absolutely. Don't wait 55 years. I was 5 years old when I first became afraid of dentists, so 55 years of this dance before it was eliminated by coming to you for hypnosis.
Excellent. What other observations or comments do you have about hypnosis?
In terms of its effectiveness, I was noticing today that when I have a dentist appointment, it's just another appointment in my daily planner. It's not a big event. I just pencil it in, and I know I have to be somewhere at a particular time, and I do it. So I would say that generally the hypnosis works in terms of keeping me clear about what's in front of me and what's the next thing to do on a to-do list or in my life.
Excellent. Well, thank you very much.